So today we're going to talk a little bit about the Cancer Center and about the program, right?
Yes, absolutely. The Martin O'Neill Cancer Center, located at St. Helena Hospital in the Napa Valley.
No wait ER.
Absolutely. You've
Always
heard the
got to get
slogan.
that in there. No wait ER. It's very exciting.
It is. Actually, it's a really nice policy that they have there for the emergency room.
As a matter of fact, it's a nice hospital. I mean, everything about St. Helena Hospital is, you seem like you're at a resort. If you haven't been there, you could go visit it and go to the cafeteria for lunch, and you would feel as if you went on a little vacation.
Absolutely. I have a next-door neighbor whose good friend delivered her child at the labor and delivery center at the hospital. And when he went to visit her afterwards, said, boy, I felt like I was at the W Hotel. I mean, it really has that type of a feel to some of the rooms, and even more so that they're doing a lot of renovations to the inpatient part of the hospital as well in the near future. So
staying up there, keeping us Napa Valley up in St. Helena Hills.
Exactly.
Just gorgeous. So what do you want to focus on this morning?
So I'd like to spend a little time talking about lung cancer, if that's all right with you.
Sure. Anything we can do to help?
We are looking at trying to launch a lung cancer screening program at the hospital sometime in the very near future that's going to be largely run through the Cancer Center. Lung cancer, just to give it some perspective, kills about 160,000 people in this country a year, which is more people than die from colon cancer, breast cancer, and prostate cancer all combined.
Whoa.
So it is the leading cause of cancer deaths, responsible for about 30% of cancer deaths in this country. So it's a huge problem. And for decades, we've really had very little change in lung cancer and very little change in the death rates of lung cancer. And then about 2 years ago, I think a real hallmark study came out showing that in patients who are at higher risk for developing lung cancer, which largely relates to people
smokers,
smoking history, exactly, people in the sort of 50 to 75-year-old range with a history of smoking, what we call 30-pack years, which basically 1 pack per day for 30 years is 30-pack years, or 2 packs per day for 15 years is 30-pack years.
Whoa.
Sort of the way it works. But any of those people who smoke that much or have smoked that much, even if they've stopped within the last 15 years, they found that those people having an annual or once-a-year CT scan of their chest found a significant reduction in the death rate from lung cancer, because with that type of screening, we're finding lung cancer at an earlier stage. And so that's really correlated to one of the first real big improvements we've seen in being able to cure those patients. Lung cancer, like many other cancers, one of the hard things is that it tends to present or be diagnosed at a very late stage, beyond the point when we can do much to cure it. We can sometimes still treat it, but being able to cure it, completely get rid of it, is a real challenge at those stages. So the real secret is finding it when it's still early.
So now you can take pictures way earlier, just non-invasive, just get a picture and go, hey, it's just starting?
Right. So doing these what are called low-dose CT scans. And low dose is important because there's been a lot of information in the news over the past couple of years about CT scans giving radiation dose. Maybe that's some risk as far as causing problems for people, but these are very low-dose CT scans. And by giving these low-dose CT scans on a once-a-year basis over 3 years, for that patient population, they saw a reduction in the cancer death rates, lung cancer death rates, by approaching 10%, which is really a big reduction.
Wow.
Because we're finding these tumors when they're very small, and when they're very small, before they've had a chance to spread to other areas in the chest or other areas in the body, we're finding that we have a much bigger armamentarium of treatment options for these patients that are less invasive, less toxic treatments, and much higher rates of cure as a result as well.
Well, we like that.
We do. It translates to better living, and as the slogan of the hospital, live younger, longer. And that really allows this, because we're finding these things when people have very curable disease and can be cured with these less invasive treatment approaches that we're now moving into. We've had some additional things that we're looking at adding at the hospital, something called SuperDimension, which is now a new way of actually diagnosing lung cancers and other lung diseases. It's a phenomenal technology. It's sort of like a GPS type of technology. Allows the pulmonologist, a lung cancer or a lung specialist, to do a procedure where they basically look down in the lung, and with a set of three-dimensional GPS maps, if you will.
Right.
Maps exactly how they can move a very small scope through areas of the lung to find tumors that are very small and maybe very peripheral or out towards the edge of the lung. And
like an angiogram? Like you could
it's an angiogram, but of the airways.
But of the airways. So you can stick little tubes down in there and curl and go around corners. And
Exactly.
Oh, we're getting tricked now.
It's pretty awesome, yeah. And that is a technology that's going to allow us to now find these tumors, diagnose them when they're still that small and early. Because in the past, sometimes you'd find a small tumor in the lung out in the periphery or out in the outer part of the lung, and you'd say, well, we can't really biopsy it with a needle. We're not sure we need to take it out. We'll probably just watch it for a little while. Well, if it's cancer, watching it for a little while,
that's bad.
Not such a good thing.
No.
Yeah.
So does that mean you could go in with your angiogram and snip it?
Yes.
Can you get? You don't even have to crack the breastplate. Do you have to crack the breastplate? Was that the old way?
Well, that's the old way.
The old way was crack them open.
Yes.
Now you can go in with a little tube.
Yes.
Oh, thank God for advances in medicine.
Yeah.
Look at that.
So this super dimension is going to be phenomenal for being able to diagnose this, and also it's going to also play into being able to really use that same technology to then help us do some new treatment approaches as well. One of the things you mentioned, cracking the chest open, we've got several cardiothoracic surgeons at the hospital who are doing what are called VATS procedures, video-assisted thoracoscopic surgery. So instead of cracking the chest open, they're making several small incisions going in with a set of scopes. So like laparoscopic knee surgery.
That's what I was thinking was the knee thing.
Exactly.
You can just go in and look now.
But now they're doing that for the chest, using that to be able to do more limited lung surgeries to remove tumors in the lung. We actually did our very first case of a really exciting approach where you can do a very limited lung surgery called a wedge resection, which if you do that to remove a lung tumor by itself, it doesn't do very well. Very high risk of the cancer coming back where you've removed the piece of lung at the sort of staple line where you staple the lung back together.
Right.
High likelihood of the cancer coming back there. But what we've done this time is there's a new approach where you do a wedge resection, but then you take this mesh material that's impregnated with radioactive sources and you sew that onto the area where you just remove the lung.
We're getting sci-fi in here.
We are. We're going to town now. But this lung mesh brachytherapy procedure that we just did is fantastic. It means that you can remove a lot less of the healthy, normal lung,
right,
but still end up giving the patient the same results as far as the cure rate that you would have had if you had removed the entire lobe of the lung. So that's one of the types of procedures we're looking at doing that's a lot less invasive. And in addition to that, we've got what's called SBRT. Now, doesn't that sound exciting? Stereotactic body radiation therapy. So it's like pinpoint radiation therapy for tumors in the body.
You can shoot radiation just to that spot.
Exactly.
Very cool again.
It's been done for tumors in the brain for years, but the brain has been an easy site for it because you can immobilize the brain. You can put patients into a halo or do other things to sort of bolt their head to the table that allows them to make sure that tumor is not going to move. Whereas with tumors in the lung, every breath you take, your lung tumor is going to be moving.
Because your lung goes open and closed, so it expands and contracts.
But now what we're doing is using the technology like Super Dimension. We're able to put little markers, spatial markers, into the area right near the tumor. And then those markers are going to be things that we can actually track continuously while a patient's lying on a treatment table getting their radiation therapy. So we can really focus and pinpoint radiation just to that spot. We'll be able to follow that tumor as it moves around and continue the radiation beam just hitting the tumor area. And so this stereotactic body radiation therapy is something we've been doing for about 1.5 to 2 years now. But we're going to be taking that to the next level very soon. We're hoping our system, what's called Calypso, which allows us to actually physically track that tumor within a millimeter just continuously, hundreds of times per second. This technology tracks the position of the
hundreds
beacons.
of times per second?
Yes. Yeah.
Wow.
So it really is. It's called GPS for the body, and it's being used right now for prostate cancer, but we're looking at hoping to use that for lung cancer. FDA is still awaiting approval on the device that's going to be used for that, but we're expecting that sometime later this year. So
you're at the cutting edge. You're
are.
like Avatar up there in the hills. You're Avatar in the hills. Everything just seems so high tech. Yeah. We're so blessed to have you in the community.
Thank you.
And just keep moving this forward so that more people can live.
Well, I'd have to say that blessing cuts both ways because being part of this community, the tremendous amount of support that the hospital and the cancer center have received from the community has been huge. And it really allows us to do the types of phenomenal things that we're accomplishing there.
Well, thank you so much. If you want more information, go to martinonealcancercenter.org, and then you can find out everything that we just talked about. Because I'm still reeling. I've just like put all that information in my brain, and all I can see is Avatar and really smart doctors with